What should I ask a portosystemic shunt surgeon? If you or a loved one are considering a portosystemic shunt, especially in the context of liver disease or liver cancer, it's vital to have a clear understanding of what the procedure involves. Asking the right questions can help you make informed decisions and understand what to expect. Start by asking your surgeon to explain in simple terms what a portosystemic shunt is. It's a surgical connection between the portal vein, which carries blood from your intestines to your liver, and another vein that allows blood to bypass the liver. This is usually done to lower high blood pressure in the portal vein, which often happens with advanced liver disease or cirrhosis. Next, ask how your diagnosis was confirmed and if other treatment options were considered. It's important to understand why this procedure is recommended over alternatives, especially if you have liver cancer. Clarify what type of shunt is being suggested, such as a surgical shunt or a less invasive procedure like a transjugular intrahepatic portosystemic shunt. Ask why this specific procedure is best suited for your condition and how your overall health influences this choice. Request a detailed explanation of what will happen during the surgery. For example, if it's a surgical shunt, it might involve open surgery with an incision, while a transjugular shunt is done through blood vessels using imaging guidance. Find out how long the procedure will take, what kind of anesthesia will be used, and where the incisions will be made. It's also helpful to ask about your surgeon's experience with this specific operation, including how many they have performed and what their success rates are. Discuss the potential benefits of the shunt, like reducing symptoms such as fluid buildup in the abdomen or bleeding from varicose veins. For example, about 65% of patients see improvement in fluid retention within a month. But it's equally important to understand the risks, which can include infection, bleeding, shunt blockage, worsening liver function, or hepatic encephalopathy, a brain disorder caused by toxins not being filtered properly by the liver. If you have liver cancer, ask how the presence of cancer might change these risks and benefits. Ask how you should prepare for the procedure. This includes any medications to stop taking, dietary restrictions, and preoperative tests. Find out what your hospital stay might be and what recovery will look like. Will you need to limit activity? What signs of complications should you watch for? Clarify the follow-up process, such as regular ultrasounds to check if the shunt remains open and functioning properly. Discuss the long-term outlook. Ask how likely it is that the shunt will stay open and what options are available if it becomes blocked or stops working. In the context of liver cancer, ask how this procedure might impact your overall treatment plan, including future cancer therapies or eligibility for liver transplantation. It's also crucial to personalize your questions. Ask how your specific health status, including the stage of your liver cancer, influences the risks and benefits of the surgery. Find out who will be part of your care team and how they will communicate with each other. Finally, consider practical questions like where the procedure will be performed, who will be present, and what support is available for you and your family. Ask about pain management, potential side effects, and when you might return to your normal activities. Remember, having a thorough conversation with your surgeon is key. Always seek advice tailored to your individual situation and don't hesitate to get a second opinion if needed. Your healthcare team is there to guide you through this process, and being well-informed helps you make the best choices for your health and well-being.